A 22-year-old comes after he starts having dizziness, nausea, and vomiting. He states that he eats healthy and exercises regularly and also goes to the chiropractor. Exam shows that his left pupil is smaller than his right and that there is decreased sensation to pain and temperature on the left side of his face and the right side of his body. What is this the result of? A. Left internal carotid artery dissection. B. Left vertebral artery dissection. C. Right internal carotid artery dissection. And D. Right vertebral artery dissection. So I'll let you answer the question and then I'll explain. So the answer is going to be B, left vertebral artery dissection. So for this question, we have a patient that has spinothalamic dysfunction. So the spinothalamic tract is responsible for both pain and temperature, and essentially it controls the pain and temperature for one side of the face, the ipsilateral side of the face, and then it decussates. Remember from neurology, decussation is when it crosses midline, and so then it controls the contralateral half of the body. So for example, if you have the left pica artery involved, then it's going to control the left side of the face and the right side of the body, just like this patient. So we have spinothalamic dysfunction, and then we also have Horner syndrome and dizziness. So this conglomeration of symptoms is known as Wallenberg syndrome, and that's when there's a infarction in the pica, the posterior inferior cerebellar artery. So the risk factor for getting this is actually the chiropractor office. So the problem is when the chiropractor moves the neck in such a rapid way, it's not designed to handle that load on the arterial wall, and so sometimes you can get a tearing of the artery, specifically the vertebral artery. And so when this happens, you can lead to Wallenberg syndrome, and it would cause these problems. So it would cause the symptoms that you would see for this patient. So you would lead to the left side of the face being insensitive for pain and temperature, and same thing for the right side of the body. Now, you can also have Horner syndrome, which is where you have a dissection in the sympathetic neurons that are traveling in the carotid sheath, and so you'll have similar symptoms, but if it was an internal carotid artery dissection, then it would actually be the opposite place. So for example, for this one, we have it on the left side, but if it was actually a left internal instead of a left vertebral, you would have Horner syndrome, and it would be on the right side of the body for a left internal carotid artery, and it would be opposite for a right internal carotid artery. And so for this one, if we had the other answer choice, right-sided pica, so right vertebral artery is dissected, then it would just be the opposite side, right? So it'd just be the right side of the face and then the left side of the body. And so for this question, we just need to know that the risk factor is rapid movements of the neck, which can lead you to be susceptible to this injury. And then seeing the Horner syndrome, which is indicated by the left pupil being smaller. So remember, since the sympathetic system is responsible for fight or flight, it's going to increase the size of the pupils to allow more light into the eye. So because of that, if you have damage to the sympathetic system, like you do here with Horner syndrome, then the only thing left is the parasympathetic system, which causes constriction of the eye. So it's going to cause the left pupil to be smaller. And then you have these symptoms. You can also have dizziness because you have an affected cerebellum, and then you can also have cerebellar problems. So the patient has a very hard time touching their nose and then to your finger when you do that cerebellar test. So I hope that helped, and thanks for watching.